Welcome to Talk Asia's Health Chats. This episode will be answering the concerns from the breast cancer survivors. More episodes are coming up shortly. Keep tuning in by subscribing Talk Asia's YouTube channel.
What is recommended for surveillance in terms of breast cancer survivors after they've completed treatment? I think I'll direct that question to Dr. Mastura. Should patients be having PET scans every year? Or should I be doing a mammogram, ultrasound will do?
Okay, the mammogram and ultrasound is a must. That one every year is a must. Some patients may actually even have it every 6 months, depending on whether they actually have the BRCA1 or 2 or PALB2 genes or not. So they will be more frequent for them. So the local assessment, please remember that, is every year at least, right, Mei Shi? So
Yeah.
ultrasound,
Yeah.
mammogram. If you don't have the breast already, like you have a chest wall, then no mammogram for that part. Just the one that is the normal
Ultrasound
breast.
in the axilla.
Yeah, okay.
Yes.
If you have done a reconstruction, right? If that it's a reconstructed breast, then you do ultrasound
Ultrasound will do, yes.
of the reconstructed breast and ultrasound mammogram for your normal breast. But for those who have risk for recurrence as well, means that, let's say, stage 3 triple negative breast cancer, stage 3 HER2 positive breast cancer. In our guideline, there is no advice or recommendation for us to do a routine, a definitive advice to do a routine PET scan or CT scan for these patients. But in my practice, if my patient actually wants it because they have anxiety over whether the cancer spreads anywhere else or not, that is discussable. Means that I can still perform those tests for my patients if that can make them sleep better at night. Okay. So I will usually do in the first 3 years, but beyond that, I tell them that, you know, if 3 years, 4 years have passed and they're good, right? So there is no point in actually performing the scans yearly for them because the likelihood of detecting anything is lower. So I do not want my patients to be exposed to radiation unnecessarily. So again, that is something that is discussable. So again, no one size fits all lah. So you can discuss with your doctor, of course.
What sort of symptoms of relapse should a survivor be looking out for?
We want to look for, number one, did the cancer come back to the same breast, right? Is there any new cancer on the other breast? Because we know that if you've got risk of breast cancer on one side, you have a slightly increased risk of the other side having breast cancer also. And the third thing we want to look for is, did the cancer spread elsewhere? Because now, remember, we talk about all these different modalities of treatment, right? Targeted treatments and things like that. Sometimes if we find the cancer very early, we only find one dot in the liver, one dot in the lung, one dot in the bone, we can actually just treat that dot and then you can continue on with your other treatment. You don't have to have the whole chemotherapy all over again. So now the surveillance is not only looking at the cancer coming back to the same site, but we're trying to detect early. If really, really malang the cancer come back lah, we want to find it out when it's come back so early that there is still a chance for us to treat it just in that site rather than wait for it to spread elsewhere, right? So regular surveillance still first, because by the time a patients usually have symptoms, by the time you feel like you're coughing, breathless and things like that, then it's very unlikely there's only one spot, right? Yeah, so the symptoms that you can feel about recurrence, actually, it depends on where it recurs. So the easiest is if you feel a lump in the breast, right? Means it's come back to the breast, or a lump in your neck, or a lump in your armpits, okay? Other things that I tell my patients to be watchful for. So I tell them to watch out for 5 things, all right? Number 1, any abnormal lumps. Breast, neck, armpit. You feel anything out of the ordinary, please come back as soon as possible. Number 2, if you have cough that doesn't get better, right? After at least 3 to 4 weeks, right? No asthma, no history of COVID, nothing recently, no infection, but you're coughing for the past 3 to 4 weeks, right? And you're not getting better, right? Please come back early. If you have bloating, abdominal discomfort, you know, you're not eating well, your appetite is not very good. Sometimes 1 or 2 days, 1 or 2 weeks when you're stressed, you have it, right? But it goes on more than 2 weeks, right? You need to come back.
Okay.
The fourth thing we look at is for any abnormal pain. All right. So obviously now we have all our normal joint pain, back pain, neck pain, but anything abnormal, out of the ordinary, right? That not what you normally have. No history of fall, injury, or anything, but the area you start to feel a bit uncomfortable, right? Starting there, you come back early. And the last one is extreme tiredness or headaches that don't get better. Okay, sometimes people get migraines and things like that. You might have on and off, but it doesn't get better over the next 2 to 3 weeks, especially if it's associated with vomiting, feeling unwell, then you have to come back. It could be false alarm, right? But I would rather have a false alarm than a patient coming with disease everywhere.
Yeah.
Right? So 5 things.
Got it. That's a really succinct summary.
So, Dr. Saladina, I thought I'll bring you in now. If we sort of change our perspective from early breast cancer going to a breast cancer that's spread to other parts of the body, as a patient going through the journey, how would you experience a cancer relapse, and what can that look like or feel like to these ladies?
In hormone receptor positive breast cancer, the relapse occurs normally later in their journey, not as the TNBC or HER2 positive, where the relapse risk is highest in the first 3 years. But for hormone receptor breast cancer, they normally relapse much later, beyond 5 years, 10 years. So they can actually present with symptoms of pain, bone pains. And normally for hormone receptor positive breast cancer, when they relapse, normally it goes to the bone first before it goes to other areas. But it can present them as a lung metastasis or liver metastasis. But more often, it's actually in the bone first. So during follow-ups, apart from examining the chest wall, examining the operated breast, you assess the axilla, you ask symptoms of possible distant metastasis like bone pain, feeling bloatedness. Sometimes when they have a liver metastasis, they can have this a distension feeling in the tummy, and of course you don't want to wait for them to have obvious jaundice before you investigate. So when the patient has symptoms that may suggest a possible relapse, then we have to investigate on these symptoms. We don't shrug off these symptoms as saying nothing, or it's purely because of your tamoxifen treatment or menopausal symptoms. So some patients, when they come with these specific complaints, and if it's persistently saying, despite all that remedies, is still having very persistent shoulder ache, then you should actually investigate. And we can investigate by doing a bone scan or a CT scan or a PET scan. Simple thing like cough, they have dry chronic cough, and they're not having any respiratory infection, but they're still persistently having this dry, irritating cough. You need to consider possibility of lung metastasis. Simple chest radiograph to see whether there's anything that warrants a further test like a CT scan of the thorax is often what we will do in the clinic.
Is there anything that they can do best to prevent a relapse?
The thing is, most of the time we have done all the treatment we need to, and I always tell patients, whatever treatment you go through, it's not. The patient will ask, would I get 100% won't come back? It's nothing. It's not 100%. We will decrease your risk to the minimum, to the best we can. So I always tell my patient, do whatever you normally do. Get on with your life. No point sitting at home thinking whether I'm going to be the 5% or the 10%.
Right.
It's no point, right? So just do whatever you normally do and just carry on your life and just do all your normal screening and things like that. That's all you probably need to do.
So you've given it a best shot. Just live life to the fullest from there.
Yeah.
Live life to your best. So life to the fullest could be drinking and smoking. So there are other things. So there are a few things that exactly like what Dr. Ng mentioned. I actually tell my patient, go live your life. Okay, go live your life. But there are certain things that you can change, right? To just give it, like, remember we mentioned any little bit may count. So exercise is actually very important, right? There is some evidence to show that regular exercise does decrease a little bit, right? We don't know by how much. I mean, we also have marathon runners who get breast cancer, right? But exercise is a good way to, number one, improve your heart function, right? But number two, also, it is shown that it can potentially, we don't know, right? But exercise regularly, usually 100, we would recommend about 30 minutes a day for 5 days a week, right? I know it's not easy. I don't do it.
Yeah.
I should. I should. Okay, I'll start exercising tomorrow. Okay, so exercise. Obviously, bad habits such as smoking, right? You want to cut that down, right? Stop if you can, but if you can't, you want to cut that down. Reduce alcohol intake, right? That has also shown to increase your risk of breast cancer. Actually, being overweight. So a little bit on a touch about tamoxifen. The unfortunate thing about tamoxifen is my patients gain weight with tamoxifen. Right. Yeah, not all of them, but very kesian. They come and tell me, doctor, I tak makan already, I don't eat anything already, still gain weight, and weight gain actually is shown to increase the risk of breast cancer recurrence. Correct. So some of these patients we sometimes switch to a different drug because cannot already. I got a lady who gained 10 kilos in 5 years, right? From tamoxifen. So yeah,
But
tamoxifen causes weight
some of
gain.
them also feel that they get very hungry with tamoxifen. They feel like they want to eat, and then sometimes some of them they actually munch. Like they don't.
So very it's it's like a two-edged sword, lah.
So, with all these treatments that we're talking about, what are the side effects that our patients need to be aware of?
Anti-hormones are given over a longer period of time. Because for chemo, there is, you finish off that, that 4.5 months or 6 months or, of treatment, and then you're done. And then you spend the next, few months recovering, from the chemotherapy. But for anti-hormones, we have to be mindful that women are taking these medicines in the long term, like 5 years or 10 years. Now, the side effects are generally akin to menopausal symptoms or low estrogen states. So like hot flashes, body aches, feeling stiff in the body, being a bit more emotional, tired, vaginal dryness, and trouble with sex. The bones can also be softer, okay? But these can vary from woman to woman, especially by age, So younger women tend to experience more of these sort of low hormone state side effects compared to older women. And also the type of treatment that we give, right? Okay, so AIs or aromatase inhibitors generally have more muscle joint kind of problems that we need to tackle. And also how long we give these treatments for. So the more intensive the treatments that we give, yes, the more hormone-related side effects. But again, there are also many studies that have shown that exercise, again, actually does help with many of the hormone-related side effects, especially the muscle and joint stiffness and all that. So, we mustn't forget that. And, we don't, when patients ask me what supplements can I take to reduce all these side effects, I say no need supplements. Exercise, it's free of charge. No need to pay money for it.
I'm a big fitness buff, so I absolutely support that.
The question that is being asked is, how long can I stop tamoxifen before starting again if I'm trying to conceive?
Okay, so our breast cancer patients are getting younger and younger, right? And so it is quite normal to, after, have your treatment, you're thinking about, oh, I want to start my family, right? Yep. So there's a trial actually called the POSITIVE study. And in the past, we were all very worried. If you're hormone positive, you get pregnant, your body full of hormones, the cancer come back. Correct? That's what we worried about. That's why in the olden days, the doctors say, no, you cannot get pregnant until, 5 years or 10 years, that sort of thing. But by the time prime age over already, right? So in the trial, in positive trials, we look at patients from stage 1 to stage 3 breast cancer. But mind you, the majority, almost 90% of the patients were stage 1 and stage 2. So if you have early breast cancer or reasonably early and the risk is slightly lower, we would advise at least taking tamoxifen for 2 years first.
Okay.
And after 2 years, you can start thinking about, stopping tamoxifen to get pregnant, but please discuss with your doctor first. Don't say Dr. Doris say and everybody stop next time. Okay. So because different patients have different risks, okay, and your doctors have different things they're worried about. Okay. So this is not blanket rule. Okay. This is if you get the CHOP serum from your doctor already, you can stop tamoxifen. Then at least after 2 years of completing your therapy, you can stop. And usually we will allow you, we are not heartless about a year and a half for you to chuba, get pregnant, breastfeed a few months, and then restart tamoxifen again, right? For those people who have never had children before, right? So you don't know whether your partner can also have kids or not, right? It's not guidelines, okay? But for practical sake, I tell my patients, if you've never had kids before, you may want to ask your partner to go and screen first.
Okay.
Because what if the man cannot have kids? Then you stop your tamoxifen for 2 years, and tengok memang you cannot have kids, but actually it's not your problem. Yeah, and then you just stop your tamoxifen for nothing, right? The protocol, some people say you can try for 18 months before going for fertility assessment. But I normally tell my patients, for practical sake, ask the man to go and check first. If he can have kids, then you stop.
I see.
Yeah.
The other thing is also before chemo, if they're young patient, you can actually give them an option to see the fertility specialist first. Sometimes they will harvest the egg, bearing the sperm, and then frozen the embryo or things like that. Then before you start your chemo.
Okay.
So that is another option. So it depends on,
Dr. Teoh, can I come back to you about diet? I believe it's an area that you are very passionate about. When what sort of diet should patients go through after they become survivors and completed treatment? Is there anything that you recommend?
Yeah, this is a very good question, very common question. Every patient will ask this question. So normally I will say that, there's a lot of, in our Asian culture, there's a lot of pantang larang. We cannot eat chicken, we cannot eat eggs, we cannot eat meat, and they just eat vegetarian diet, very bland diet. And I think that's not right. Okay. Again, we have different cultures, Chinese, Malay, Indians, they have each of their own favorite type of food as well, and also Western as well. So I want to be generalized, all right? Always avoid processed food, okay? Go for fresh, natural food that you can buy in the market, right? Rather than having spirulina in the powder form, better have fresh vegetable. Whether you want to have it raw, cooked, or steamed, it's okay, right?
Okay.
And try to have fresh, natural food over the processed food, okay? You of course, you need to eat more vegetables and fruits, which is better. 5 different colors or 4 different colors, at least 1 fruit a day. All right. And then you must have enough protein. You must eat enough protein. So what I find is like a lot of our cancer patients, right? They, even those that are going through not just survivorship, those who's going through chemotherapy, they don't have enough energy because they don't eat enough protein. So a protein is a very important part of our diet because that helps to increase our amino acids as well as build up our cells. So when we're going through chemotherapy, some of our cells are getting depleted, yes, but you need to eat good protein. So patients who eat generally anything and everything, even meats as well, they do fairly well on their chemo treatment. Am I right, Mastura?
Yep.
Right? Yeah.
What is an example of good protein, Dr. Teoh?
Yeah, good protein will be like, fish. You can have, it's okay to have chicken. If you're worried about those hormone injected chickens, right? Then you can, find organic chicken or farm fed chickens as well. Fish, chicken, salmon, right? And then even eggs is okay. Right. So
Okay.
I mean, this can be another hour of lecture as well. So try to have everything in balance. Balance, I always go for a balanced diet. That means you can have everything, even soya products as well, soya milk, tempeh, tofu, but you have it in different days. Even if one thing is very good, if you have it every day, it's also not so good for you.
Okay.
All right.
And
So
then-
have a balanced diet. You can have what you like, but in better portions. Avoid fried, avoid like fried like KFC. Those are no good, isn't it?
Right,
Yeah. Or
right.
all those sweets and processed food.
You mentioned sweets. So one of the questions we got received was whether fasting on carbohydrates, fasting sugars, abstaining from carbohydrates, would that help in preventing recurrence?
I wouldn't say specifically that that's going to prevent recurrence, all right? Yes, that's also part of our natural health. We want to go on a healthy lifestyle, all right? So half your plate should be vegetables and fruits. The other quarter should be good proteins. And the other quarter will be a mix of good fat, which is avocado, salmon, fish oil, omega oils, and then a little bit of carbohydrates. So carbs, you also need carbs because of the carbohydrates, but majority of your energy should come from your protein and your fibers.
Right. Okay. That I think is very informative, and as Malaysians, we love our food, so I think that's a really helpful guideline, Dr. Teoh. This other question that we have, can breast cancer survivors actually donate blood? Can we participate in donation? No? I see Dr.
No.
Mastura shaking her head. All right, that's an easy one.
Subscribe Talk Health Asia's YouTube channel for more Health Chats episodes, or find easy to understand health videos on talkhealthasia.com.